Dr. Michael Taggart with the Kirkland Thyroid Institute. I have over 18 years clinical experience helping people just like you overcome chronic health conditions. In our office, we specialize in a comprehensive approach to thyroid disorders that have not responded to traditional medical care. This video is the first in a series of videos where we'll be talking about specific principles and testing that must be done to help you get better. The first secret that I'll be sharing with you today is the distinction between laboratory ranges and functional laboratory ranges. Okay, now this distinction is very important and is the reason why countless patients will go to doctors and have obvious thyroid symptoms and the doctor says that they're normal. So we're going to help you really understand why this is happening, and a lot of patients who come to me tell me that that's what their doctors told them. It's very frustrating. We're going to really clear that up today. So the functional range and the laboratory range are different. The laboratory range is based on pathologies. They're looking for dying tissue, tumors, things that are like very serious. And there is some validity to that. However, if we want to get you to a healthy state, we have to use a higher standard. Laboratory testing, or the pathological range, is based on averages of sick people. So why would we use the averages of sick people as a marker and as a goal to shoot you towards? We want to use the averages of healthy people because that's where we want you to get, is to health. Functional ranges are a national standard that is set throughout the United States. Pathological ranges are what we call laboratory ranges, the same thing, are based on different labs having different ranges, and it's actually different in different states. So we want to use a much higher standard. We want to use the functional range. Now, let's talk about an important marker for thyroid, TSH. TSH is what your pituitary gland makes to stimulate your thyroid to make thyroid hormones. The pathological or laboratory range is 0.3 to 5.7. That is way too broad. Many people who are on the high or low end of thyroid are going to be missed by using this range. You have to be extremely, extremely ill in order for these lab markers to have a lot of meaning. Now, the functional range is 1.8 to 3.0. If you have a recent blood test and your TSH is not between 1.8 and 3.0, you have a problem. Now, if you have been seeing doctors and they have not been able to help your thyroid problem, you need to find another doctor who can address your thyroid condition correctly so that you can get your life back. Now, what we're offering in our office is 2 free visits. Those 2 free visits allow me to meet with you, review your health history, ask you questions, and the second visit, I'll sit down with you and we'll set a corrective course of action so that you can recover, so that you can start doing the things that you want to, like have energy, not be cold all the time, address any focus or issues of depression that often people who have thyroid issues have. So if you're serious about getting better, give our office a call at 425-821-1101 and set up those 2 free visits. I've also included a recent testimonial that we have of a thyroid case. I'm really looking forward to speaking with you next time where we talk about the number 2 secret to helping you overcome your chronic thyroid condition. Okay, here we are with Stephanie, and Stephanie has been involved in our thyroid recovery program at the Kirkland Thyroid Institute, and she's going to share a little bit with us about what she's noticed about her care and her improvements. And so, Stephanie, if you could just kind of start off about, what caused you to want to seek care in our office, and what were some of the major things that were affecting you before you came to our office?
Well, hello everyone. When I first started out, I had thyroid problems, which really changed my mood, and which also changed my weight, and I've been having weight problems for a long time. Now I'm noticing that my weight's going a little down now, and I was very frustrated because the other previous doctors, which are endless amount of doctors, I've seen endocrinologists, different blood work, different types of doctors for headaches, and I've been having headaches ever since I can remember for the longest time, and it was really annoying because none of them could figure out what was the cause. So that's why I wanted to see Dr. Taggart, because with my headaches, now seeing him, it's very limited. And with my pain, overall, it's getting better. And I even feel better, and because of also my diet's changed as well to benefit the way I am right now. And I noticed that I feel more energized, happier, I'm more talkative, I want to do more things, and it's helping me a lot with my schoolwork. And with my schoolwork doing better, I end up doing more homework, I'm enjoying, I'm talkative, and therefore I ended up also getting a art scholarship as well for school.
Right, and you really had struggled with school, getting your work done on time, and having to spend a lot more time getting it done. And now you're actually doing so much better that you've actually been awarded a scholarship, which is amazing. That's really great. So we talked about the low energy, the issues with the weight, the attitudes, like the mood swings, things like that. Overall energy level, that's all doing better, which is great. And the headaches are also doing better.
Yes.
And what have you seen as how our approach is different from all the other doctors you've been to? You've been to a lot of different doctors. What have you seen as being different in our office, and why would you recommend someone else seek our care who has similar problems to you?
I would recommend Dr. Taggart a lot because he treats you like a patient, not a number. He also wants to find out every single thing that's causing it, not just doing blood work and then just giving you all sorts of chemical medicines. Instead, he wants to do it more natural with herbs and figuring out what was the cause and then breaking it down to what's the real cause. Instead of just, you have a weed and you take the weed off, but then it'll regrow. And Dr. Taggart wants to get the root to the problem and find out. That way, if he takes it out, you'll be better. Instead of just having the problem reoccur, which doctors didn't really do until I met Dr. Taggart.
That's great. And so you've noticed, as more and more weeks go by with your care, that you're steadily noticing more and more improvement.
Yes, I am noticing a lot of improvement.
That's really exciting. And are you quite hopeful that you're going to continue to improve as more time goes on?
Yes.
That's great. And Norma, would you like to share about what you've noticed about what's different about Stephanie since she's been in our thyroid recovery program?
Oh yes, of course. From a mother's point of view, I was like with my hands tied, seeing my daughter with those big headaches, lack of energy, and like a couch potato. And you says, God, where I go now? With which doctor I take my daughter? And thanks God that he sent us straight with Dr. Taggart. He is in front of me, and with all my heart, thank you very much, because the difference, like day and night, my daughter, how she's acting now, she's more active, more talkative, smile more, not in the big bad mood that she was before.
Yeah.
And she's always a hard working girl.
That's true.
Homework. And before, wow, she knew that she has to do the homework and takes forever to do something, and I see her face suffering. And now she just sit and go quickly and doing it. And of course, not everything has disappeared yet, but like they say, slowly but surely.
Yeah, it takes time.
Takes time. Everything takes time. It's not a miracle. And it's the first time that I see a doctor like you, Dr. Taggart, and like the first time that you mentioned something about the magic thing with the white owl, like Harry Potter, and that's a nice thing to say, and I told my son too. But this is different, even the medicine. With the other doctors, they just say, oh, like this thyroid, okay, well then you can use this or that, whatever. But the medicines have a lot of side effects.
Right.
She was taking metformin, and that was the medicine that was putting her like out, but I mean out. Since she stopped taking that, helps a lot. And the medicine that you are giving her,
the supplements and things like that, it's all natural. Yes,
those natural things, natural things,
not drugs, right?
Not drugs. Before they just put more milligrams, less milligrams, up and down, and the same thing. And now it's a lot difference day and night. And I just really hope that a lot of mothers can be like me, that I was so lucky to find somebody that works like you. And if I know, I already talked with 2 or 3 people and I told them about this. Because I say from the mother's point of view, you have your hands tied. And I am going to do this all the time, that I see somebody that needs help, I say, Dr. Taggart, first God, and then Dr. Taggart.
All right.
So God bless you.
All right. Thanks so much for sharing. I really appreciate that.